Alrighty, hello everybody, and welcome to this latest community conversation with Minds at Work. One of the aims of this community is to connect people with ideas and ways of working that can help to establish more mentally healthy workplaces. And this month we've been talking about business cases and putting mental health and well-being on the strategic agenda at board level. One of the outcomes of this is to hopefully have dedicated resources responsible for mental health and well-being in the workplace. Yet there's no real traditional job description or strategic approach to the wellbeing role in business. So what are these jobs? What can you actually do in the role? And why should you be investing in a wellbeing role when we're facing the biggest recession and cost of living crisis in a long, long time? Today, I'm excited to welcome Amy McKeown to our conversation. Amy is an award-winning and highly experienced strategic health, mental health and well-being consultant. That's a bit of a mouthful. She coaches organizations of all sizes, putting into place evidence-based, measurable and sustainable strategies, which are both innovative and fresh, as well as realistic. She combines a clinical background in psychology with expertise in mental health, occupational health, health analytics and health insurance. And we're excited to have her here today. Welcome, Amy.
Thank you. Lovely to be here.
Awesome. So let's start with the obvious with this conversation. When we talk about wellbeing roles, what do we actually mean?
Well, that's the $1 million question, right? So I think it varies depending on which organization you are in. And I mean, certainly wellbeing roles as a whole have only really been around a couple of years. I mean, probably 5 years, you've been starting to see wellbeing jobs in organizations. They're sort of multiplying like mushrooms at the moment, but there is sort of a big debate over what it is and what it means and what well-being is and what you're actually doing in these roles, hence our conversation today.
Mm-hmm. Okay, so in your opinion, from your experience, what can you actually do if you are an in-house well-being person?
So I think the thing is to look at how well-being is set up in an organization. Like, firstly, what well-being is and what it means. The reason that you had the mouthful kind of with health, mental health and well-being is I've always worked more across health and mental health as well as well-being. So how you look after the health of your organization, how you look after the mental health, what providers you've got in place. Well-being is a sort of like word that's come up over the last few years. I mean, I've been in this industry 20 years. Like, my father was one of the first he got an honorary degree for putting in the mental health in AstraZeneca in the 90s. So like, we've been around, and there's been like, is it stress? Is it positivity? Is it energy? We're now kind of talking well-being, right? And we're seeing a lot of well-being leads, but there's a huge spectrum as to what well-being in an organization is and what it means and how it's approached. Like, whether it's a well-being lead, whether it's someone doing diversity and inclusiveness and well-being, whether it's someone who's doing health and safety and well-being, you know, it all totally varies, as does the well-being lead, right? So some well-being leads are very junior roles in HR, where you're running around and putting in webinars in place. Some are more senior. You know, we're seeing the rise of the global well-being lead. We're seeing the rise of the chief well-being officer in some organizations, but it's like totally variable. And what you're doing in those roles, I feel, is also totally variable. And that depends on where the role is, what you can actually do, whether it's a job in HR that's quite junior, whether it's actually board level. If I'm going to be blunt, most of the roles that I've seen are way more junior than they might appear on paper. There is questionable amount of budget or resource or seniority given to those roles. And you're seeing, you know, if you are in a large organization and you're like 4 or 5 rungs down in HR with no budget, it's really questionable as to about how much impact you're going to have on the well-being of an organization, and indeed what well-being means.
So are you sort of seeing in your work, are you seeing a lot of tokenistic efforts towards well-being then?
So I wouldn't say tokenistic. I would say that people are talking about it more than they ever have. I think there's a genuine interest in organizations to do about it. I would question whether that, you know, the motivation behind it for some firms. There's definitely some firms that want to do it right. And I mean, I don't think you would create a well-being role unless you genuinely wanted to do something, whether that's for improving employee experience and engagement, health, You know, some people have even figured out that if you look after our employees, then they will perform better. So it's kind of like, you know, there's definitely that. What I would say, though, is that's still a long way from really changing culture and having someone senior enough to do something, right? Yeah, it's quite an easy fix for an organization to create a kind of HR based role in well-being and then to sort of say, look, this is how much we care about our people because we've got a well-being lead and we run some webinars. Yeah. I think what I am yet to see or see a little of is the really board level position on health, mental health and wellbeing. And I say health, mental health and wellbeing deliberately here, not wellbeing, because to me, there is the rise of the chief wellbeing officer. And that I assume is looking at wellbeing across how an organization runs. But I think that the next business issue of the next 10, 20 years is actually going to be health and mental health, not necessarily wellbeing. Who pays for our healthcare, how we look after employees who are off sick, what providers we have in, how we, because at the moment we've never really had adult conversations about the responsibility of health in this country and who pays for it, right? So kind of like who pays? We've grown up since like 1958 with the NHS, and if someone goes off sick, you wait for a GP appointment. And there was a news article as I was dropping the kids off this morning on the 9 o'clock news that was talking about the government giving you a 2-week target to see a GP. Like, you know, we have got into a system in our country where I can make myself as ill as I can through an unhealthy lifestyle and I can go to the NHS, you know, so like we don't have adult conversations about who pays for healthcare. And so with some of the organizations I work with, I talk to people about, you know, providing anti-smoking support for employees. And there's always, oh, well, I'm not the boss of my employees. I shouldn't be telling them whether to smoke or not. And I'm like, well, you're paying for their health insurance, because a lot of organizations pay for health insurance. You're paying a higher premium because your employees are smokers. So are you happy to do that? And that's a very different conversation, because we've never really had adult conversations about who's responsible for looking after health and mental health and who pays for it. And that's going to be the defining issue, I think, personally, of the next 10, 20 years. So why I differentiate between health, mental health and well-being is it's quite easy for an organization to talk well-being and do soft kind of stuff around well-being, and it's about engagement and making people feel healthy, but that's actually hiding the reality of health and mental health. And I think it's health, mental health and well-being that's the board level discussion, because there is a cost to employees being off sick, there is a cost to providing health insurance, there's a cost to that. So there's the difference. I mean, the well-being lead tends to, in my experience, be the more junior well-being stuff. The conversation I think will end up being board level will be health, mental health and well-being, as opposed to just well-being. You see what I mean?
Yeah. So in your mind, I know there's no real job descriptions, there's a lack of regulation, there's no real idea out there of what this can be. In your mind, what is an ideal situation? Like, what would you like to see happening in terms of these roles and the focus on this at board level?
Well, those are different questions there, right? So yeah, I think organizations to be very honest and real about what they're doing and what they're not doing, right? So, I mean, the Molly Russell case, which is going on at the moment, is very interesting because there's all the tech firms are being brought into that and they're being asked to show accountability. Every single one of them has wheeled out a well-being or mental health lead, right? And it's like, oh, we care about mental health, that we've got a mental health lead in place. Likewise, one of the big four sadly had a suicide a couple of weeks ago. And I noticed that the mental health lead was quoted in the article, which is certainly a step forward from 5 years ago when these roles didn't exist. But it's like, are we shifting accountability by having a mental health role or lead means that we don't actually really have to do very much. So I would like to see at board level, you know, it being taken seriously and health and mental health being seen as intrinsic to a business as factories and roles and stuff like that. I think there's a real honesty check about that, because it's much easier to create a kind of slightly more junior HR role and say you're doing it and then wheel that person out to say you care about it. I also, in the 20 years I've been in the industry, you know, it has exploded. Everyone seems to be a mental health expert now. Everyone seems to be a well-being expert. You know, people with lived experiences sharing their stories, which is great, but they're now writing strategies for large multinationals. And it's like, well, hang on, kind of like, that's great that we're now talking about it more. But what I see with the organizations I work with is that they don't know what to do. They're either at the start of their journey and are completely freaking out because there's so many providers and so many experts and so many people talking about it, they don't know where to start. Or they've done some stuff and they want some expertise to bring it together and structure them to the next part. And what I've often do a lot of work with organizations now is helping them to identify what they need out of those jobs. So often an organization will want to create a more junior wellbeing lead, but will bring me in to write the strategy and maintain a strategic partnership with me because they're honest about the fact that they've got a more junior role, but they're also honest about the fact that someone in a more junior role won't have the same strategic level of expertise going forward. So that, I think, is starting to differentiate the difference. And that's a useful conversation because it used to be that, a wellbeing lead was a generic term, right? I think it's been really clear. I either don't go down that route at all, or I have the more junior role, but if I have the more junior role, it's not going to be a strategic role. We're not going to be looking at procurement. We're not going to be looking at absence and health because that person doesn't necessarily have the skill set. Or we go the senior, but also being really honest. And I say this being very aware, I'm speaking to a community of people working in this space. What skill sets the people in these organizations that you're bringing in actually have, right? There are a million wellbeing experts on LinkedIn today at the moment, right? And I say this being someone, and consultants and people who say they write strategies and mental health experts. I mean, I've got videos on my website of me a few years ago challenging beware the mental health expert, right? It's a bit Wild West like. It's sort of so we need to be really clear, like, what is an organization doing? What are they trying to achieve? How senior is the role? And what skill set is there for the person you're bringing in, right?
So on the idea of accountability of roles or skill sets, one thing we have also seen the rise in is the mental health first aider. Yeah. So what do you think you need a wellbeing role and a strategic approach to that if you've got the mental health first aiders? What's the difference there?
I sat on the board of Mental Health First Aid England for 3 years. At Ernst & Young, where I was working at the time, we were one of their first big clients and we rolled out mental health first aid extensively. We did not have a mental health first aider in the business. Right. So I believe that mental health first aid is a great literacy training program. I think it's great for educating. We very specifically at the time, I mean, I don't know what Ernst & Young are doing now, used it as part of a structured strategy that I'd written for some of the stigma and awareness raising, and we rolled it out like that. We did not have a mental health first aider in the business. I spend a lot of time with organizations. So how most organizations have moved into mental health is they've discovered that everyone's talking about mental health. They've decided they want to do something. There's usually a very wishy-washy statement or strategy that's based along the lines of reducing the stigma and raising awareness. They've then gone because it's cheap and easy and bought mental health first aid training. And then they've now tied themselves in knots often around what the governance and boundaries of the mental health first aid role is, right? So I was talking to an organization yesterday that has a whole mental health first aid network. And I was asking what sort of first aid their mental health first aiders had given. And the long list of things, if they'd been used at all, to be blunt, were things that should really have been dealt by either the EAP, HR, or a line manager. They were not mental health first aid issues. I question whether a day or 2 day or half day literacy training course around what basic mental health first aid is a first aid role. So there's a whole piece about how we structure and roll out. I mean, it's been worked wonderfully in some organizations. In other organizations, you've got peer-to-peer support being given with no organizational structure. It's often one person who's picking up all of the peer-to-peer support from the rest of the thing. So there's a whole discussion about mental health first aid. That is very different from a wellbeing lead role, right? A wellbeing lead role is someone that would structure the program, that would think about a strategic approach, that would think about how we prevent illness and keep well people well, how we look and intervene in the early stages of illness, how we manage people back to the workplace who are off and support them whilst they're off, the legalities in that, the care pathways, the practicalities, who's responsible. That's not a mental health first aider. A mental health first aider is someone in a business or an organization who's signed themselves up to a half day or 1 day course on what mental health first aid is, because generally they're interested, right?
Yeah, absolutely. It's really important to make that distinction between, I guess, ongoing responsibility and someone who has done a course, is what it comes down to.
And
really.
what the course covers. So mental health first aid analogy, I mean, it's brilliant. I mean, why I rolled it out at Ernst & Young when we first got it in there was because it was the most comprehensive course I'd seen at the time on what mental health is. But it's signposting.
Yeah.
And it's peer-to-peer support, and it's an education. Yeah. So it's sort of, it's a wonderful literacy training tool. I question, like I said, the way that most organizations have approached mental health is they've sort of shot off and done it because it's quite sort of the zeitgeist, and mental health first aid because it's cheap and has been sold in as an easy way of ticking the box is sort of everywhere. But the bit that I see, I mean, 3 of my most recent clients have had a mental health first aid network that they've put in, and they're not really, they're turning the dial on mental health. They're a bit stuck. It's not really done anything. Then they've got me in to actually write a strategy for how to structure the whole program going forward. So I'm seeing a lot more of that, right? You know, it's, and that's a very different skill set. Yeah.
Yeah, absolutely. So the obvious question with the news being as it is this is all going to cost money for a business. So why should a business invest in this sort of well-being role when there is an economic crisis going on?
So there's 2 points to that, right? Firstly, and this is the point that is always missed, all organizations are spending a lot of money on health and mental health already. Through absence, through providers if they've got them, through, we just talked about mental health training, right? It's not strategic spend though. I mean, what I do with some of my larger organization clients, right, is actually look at their absence. I mean, most organizations don't even monitor absence, even huge ones. You'd be shocked at the number of people who don't know absence, but like an estimation of absence, you're already spending, if you're a large organization, thousands, if not millions, on absence, right? But it's unstrategic spends that's scattered all over the organization, right? So I think where we need to move away from is thinking about this as finding money and investment to actually looking strategically about what we're already spending and how we want to manage that spend. Because the way that the market evolved in the UK is that, you know, absence we don't measure or quantify. And a lot of organizations, especially the larger ones, have providers like EAPs or Headspace or mental health first aid, or they've got private health insurance for senior people. You know, actually, they're already spending on stuff. And how it's usually gone in a large organization is that well-meaning benefits person has gone to procurement and they've gone to a broker, and that broker's gone to some of the commoditized large health providers that are out there, and then it's gone back. So we're not talking about people with any clinical background or experience procuring products in an organization or challenging providers, right? So I spend a lot of time with organizations looking at how much money they're already spending on this stuff, and then we can have a far more sensible and less scary conversation about, it's not about finding the money or investing, it's about actually redirecting some of the spends that is already going out of the business, but doing it in a different and thoughtful and more strategic way. So that's the first point. The second point is, yes, we are heading into a recession, but I think what we're also seeing, which is fascinating to watch actually, is that the first time since the Industrial Revolution, and especially post-COVID, and especially with young people and hybrid working and people, employee engagement where it is, and all of the conversations that I was saying at the beginning about who pays for healthcare, it's starting to dawn on people that, you know, we're not factory workers who are resources now. Most work, not all, but a lot of work is creativity and brain and human ingenuity. And
Mm.
if we are not well and healthy and mentally healthy, we are not as productive or profitable. So actually stopping to look at people, it says it in itself, human resources, right? We are resources. You know, there's always been this sort of, since Henry Ford, like we are Lego pieces that you move around. I think it's dawning on people that actually, if people aren't healthy and well and working, then that's actually a bigger cost to the organization. I was able to quantify where I worked once that health insurance, which was only given to senior people, I quantified the difference between someone junior without health insurance being out of the business and someone senior. I think it was with depression. And I was able to prove a case, which did not go down well, that if we actually stop looking at health insurance as being an employee benefit and actually gave it to everybody, it would save us money in the long term, because the person who was more junior had cost more being out of the business and being left to the mercy of the NHS than the person who had health insurance. So it's about looking at things differently. It's not about investing more. It's about, we've never really thought about this. And we wouldn't create a job role or a senior role or open a factory without quantifying it. But for some reason around health and mental health, we don't. And then we create a tiny little pot for well-being that is like fought over between Pilates instructors and mindfulness and, you know, whether we have fruit bowls and stuff. We're not actually investing properly in health and mental health and looking at it as a business, you know, necessity.
Absolutely. I'm mindful of time, Amy, and I know that you're a busy lady. So we do have a few people in the room live. I'm just wondering if anybody in the room has any questions that they would like to ask of Amy.
There's a couple of things on the chat. So Leora's put, with mental health first aid training being peer-to-peer, is there a certain size organization this would not be suited to? Not really. I mean, what I would say about mental health first aid is to be really clear that this is peer-to-peer support, right? And it's peer-to-peer support with someone who's been on a literacy training course that's all about signposting, right? So it doesn't matter what size organization it is, but where are you signposting to, right? How does that fit into your structures? And is it appropriate to have peer-to-peer support? Right. So yeah. And then Ashley's put, I completely agree on mental health first aid. It's a new course. It's much better about yes. And Trisha, you've put mental health first aid is the equivalent of physical first aid. So hang on, when comparing mental health is like comparing physical first aid. So what I would say, and this never goes down well, is the difference between physical first aid and mental health first aid, and where I think the mental health first aid model falls, is I could walk down the streets, and if I saw someone outside my house who'd had a cardiac arrest, I could give that person CPR because I've had a physical first aid training. With mental health first aid, it's a lot more nuanced than that. So I'm not sure that you're going to go up to a completely random person in an organization and talk to that person. I understand the concept of it, and I'm not sure that person is necessarily going to be able to give the best advice. I mean, it's not about advice. We're not talking counseling. And certainly I've run mental health first aid networks. I've run buddy schemes. And what you often find is the people that sign up to be mental health first aiders are people who've either had mental health first aid issues or have had it in their family or are interested, and they're not necessarily the right people. And often it turns into a sort of counseling relationship without much structure. It's not the same as just signposting. I don't see that. I see where I used to work, and when I've run it, it tended to be slightly, you know, it became more of a counseling relationship with two untrained people in the organization outside of any formal HR or structured process. So I get it. I understand what it's trying to do. Agree with you, Trisha, about it can be a listening ear, but I'd also, I've seen it work really well. I've seen it end up very, very badly with mental health first aiders off sick, with having, one person taking over a lot from the rest of the firm and stuff. So yeah, it is what it is. It just needs thought. Yeah. And a wellbeing lead is your strategic person or person putting a program in place, not necessarily doing the counseling as well.
Awesome. Thank you, Amy. I guess to wrap it up, have you got This is our month of focusing on the strategic case for wellbeing. Do you have any final thoughts on taking a strategic approach to this sort of role?
Well, I mean, when I work with clients, the first thing we do is have a really honest conversation about the difference between health, mental health, and well-being, right? If you don't have that foundation in place as to what you're actually trying to achieve, and that's the bit that's often missed, then you can't achieve anything. So it's being really honest up front, what you're trying to achieve and how and why, and then the commitment and the resource and the strategy, right? What I see in wellbeing a lot of the time is, it's like I said, a junior role that's been built up by someone who cares about wellbeing and is enthusiastic and sits somewhere around HR or wellbeing. So if you're going to do it strategically, like, you know, do it as you would anything else, but also like challenge yourself on the difference between health, mental health, and wellbeing. What are we actually trying to achieve here? You know, like, what is wellbeing versus health and mental health? And post-COVID, we saw the impact on organizations and businesses of people being off sick or being on quarantine or being unwell. It was a huge financial implication. So still talking about well-being, you know, it's like we don't want to go there. And really, as a country, and I appreciate not everyone here is in this country, but who is responsible for health and mental health? Is it the individual, the state, or the government? And who pays for it? You know, we're still not having those conversations. It's much easier to talk about well-being and mindfulness and how happy everyone is than to actually really bluntly ask who pays for this stuff.
Absolutely. Awesome. Amy, thank you so much for your time. This has been fascinating, and it's always great to hear. I believe you have some classes and things coming up. So
yeah. So I mean, I do a range of different stuff, but one of the things that I do is a lot of masterclasses that are online, where we you'll find them on LinkedIn. There's a lot on my website, which is amymckeown.com. What I'm doing this autumn, which is quite exciting, is I've really gone back to basics. So I'm doing one every fortnight, looking at how to write strategies, how to implement, how to find the right providers. I'm a big passionate believer in women's health, so there's some stuff on women's health. I've got some stuff on, there's a stress awareness day coming up, because obviously this is a big period for health, mental health. So really back to basics. But I mean, my stuff tends to be more B2B, more practical how-to type stuff. So look me up and you're very welcome. I'd love to see some of you there.
Awesome. I will make sure we share that when we share the link, the recording of this. So with that, thank you very much, Amy, and those in the room or those watching on replay, please do continue this conversation in the community. It's all there to help you have these conversations with each other. So some of these discussions that have been happening in the chat, absolutely brilliant. So please feel free to pose those questions to the people as well.
Thank you, everyone.